Hello, and welcome to the National Institutes of Health virtual seminar. My name is Dr. Richard Benson, and I'm the Director of the Office of Global Health and Health Disparities in the Division of Clinical Research at the National Institute of Neurological Disorders and Stroke. The NINDS seeks fundamental knowledge about the brain and nervous system and to use that knowledge to reduce the burden of neurological disease. The NINDS supports and performs basic translational and clinical neuroscience research through grants, contracts, cooperative agreements, scientific meetings, and research in its own laboratories and clinics. The NINDS funds and conducts research training and career development programs to increase basic translational and clinical neuroscience expertise and ensure a vibrant, talented, and diverse workforce. NINDS promotes the timely dissemination of scientific discoveries and their implications for neurological health to the public, health professionals, researchers, and policymakers. The NINDS is committed to reducing the disproportionate burden of neurological disease borne by underserved groups of society, including racial and ethnic minority, rural, and socioeconomically disadvantaged populations, by funding a spectrum of research from basic science through clinical studies and training the next generation of health disparities investigators. The Office of Global Health and Health Disparities leads the coordination and development of programs and initiatives that foster national and international research on disparities and inequities in neurological disorders. The objectives of this office include building sustainable capacity in low and middle income countries to conduct and apply research to address public health challenges associated with neurological disorders, supporting bilateral partnerships between the US and middle to high income countries in research areas that are mutual interest, and advancing research and tailored prevention and treatment strategies aimed at improving health outcomes in underserved and understudied populations in the US, including racial and ethnic minority, rural, and socioeconomically disadvantaged populations through investment in research and training. My office is also in the midst of a strategic planning process for the health disparities priorities for the next 5 to 10 years. For this process, we are using the Healthy People 2020 definition of health disparities. Healthy People 2020 defines health disparities as a particular type of health difference that is closely linked with socioeconomic and/or environmental disadvantage. And this may be related to race, ethnicity, socioeconomic status, gender, age, or geographic region. Health disparities carries a negative connotation and stigma to some, and so we're using the term equity. Equality ignores the inherent differences in individuals, as you can see on the left side of this diagram. The term equity takes place and includes the demographic, economic, biologic, and other determinants of health that may affect various individuals in our society. We currently have three work groups that have been created for this process. We've gone through an information gathering process where we received information from people outside of the NIH. We also are in the process of organizing a workshop that will culminate all of this process in September 23rd and 24th of 2021. And this will end with a document that we will use for our strategic planning process for the next 5 to 10 years. In addition to this process, we're also doing a portfolio analysis where we're looking at all of the health disparities related research projects that have been funded by the NINDS. And we're looking at all of the various metrics that are listed on this particular slide. We will analyze that information based upon the National Institute of Minority Health and Health Disparities Research Framework. My office is also responsible for keeping track of individuals enrolled in NINDS-sponsored clinical trials. All NIH-funded clinical investigators and clinical staff who are involved in the design, conduct, oversight, or management of clinical trials must be trained in good clinical practices. Please see the NINDS website for more information on this and how to find training. The principles of good clinical practice help assure the safety, integrity, and quality of clinical trials by addressing elements related to the design, conduct, and reporting of clinical trials. GCP training describes the responsibilities of investigators, sponsors, monitors, and IRBs in the conduct of clinical trials. GCP training aims to ensure that the rights, safety, and well-being of human subjects are protected, clinical trials are conducted in accordance with approved plans with rigor and integrity, and that the data from clinical trials are reliable with proper inclusion of racial and ethnic diverse participants. Stroke currently is the second leading cause of death worldwide. The rising prevalence of non-communicable diseases worldwide and the high prevalence of other neurological diseases highlights the need for and the importance of the NINDS Global Research Portfolio. On this particular slide, we list all of the various announcements, funding announcements, of which the NINDS participates. Many of these are sponsored by the Fogarty International Center. This information can be found in the NINDS file under the DCR, or Division of Clinical Research Information. Here I'd like to highlight all of the other individuals in my office that help to do this very important work. We have Stacy Chambers, who's our health program specialist, Dr. Erica Littlejohn, who is a AAAS fellow, and Miss Naomi Booker, who's our operations coordinator. We thank you for your time, and I hope you enjoy the rest of the NIH Virtual Forum. Thank you.